My name is Dr. David Spight, and I am one of the interventional physiatrists at Summit. And my job is to utilize historical information derived from the patient, physical examination, imaging, and to come up with a diagnosis for specific complaints of cervical, thoracic, and lumbar pain. For extracurricular activities, I'm an avid reader, politics, history. I like to bike. I'm a movie buff. Like to spend time with my wife and my pets, and we like to travel. Early on in my life, I thought I wanted to be in the healthcare profession because when I was in high school, I did part-time work at an outpatient dialysis center after school. And so that piqued my interest in medicine, and then the rest was history. In undergraduate, I started, I was premed, and so I wasn't sure whether I would go into dentistry or medicine. And so I chose the healthcare route. And after undergraduate, I actually went to chiropractic school. And I practiced chiropractic for about 7 years out in Massachusetts. And then I said, well, no, I want to do a little bit more, so I went back to medical school. I was drawn to spine or interventional physiatry from my chiropractic background. It seemed like a natural segue into medicine. I wasn't sure whether I'd do orthopedic surgery, or in fact, I didn't know about physical medicine rehabilitation until I got into medical school and started to speak with some of my attending physicians and some of the guest lecturers to our medical school, and they thought it would be a good fit for me. And I started looking into it, and I agreed. I thought it was a great fit, and so I went to Southeastern College of Osteopathic Medicine in Fort Lauderdale, Florida. After that, I did a residency in physical medicine rehabilitation through Wayne State University out of Detroit. And I also did an interventional spine fellowship in Fort Wayne, Indiana. And after that, I started practicing. What gets me up is to see people engage the narrative, be able to identify with my patients, because more times than not, what patients are seeing us for, we as healthcare providers suffer from ourselves. So when we can provide that insight to them, that helps them to understand that we aren't just providers and we're impervious to what they're seeing us for, that we can suffer from the same maladies. It gives us that common bond, and that enriches that patient experience. So I look forward to that, and I embrace that.